Good afternoon, everyone. My name is Rebecca Saltzbaugh, and I am with the Peer and Family Support Program. I would like to welcome everyone to today's webinar on teaching peers about stress management and healthy coping. Thank you all so much for joining us. Before we begin, I would like to take a moment to introduce you to our presenter, Lauren Presutti. Lauren is a cross-discipline practitioner of both mental health treatment and disability activism, and she's positioned as one of the only experts who is focused on the intersection of both of those subjects. She's committed to changing the social landscapes that subject individuals with disabilities to social stereotypes, inaccessible infrastructures, and misguided expectations from others. Diagnosed with muscular dystrophy at age 2, Lauren has been using a power wheelchair since she was 5 years old. Her firsthand knowledge of disability, empowerment, inclusion, resiliency, mental health, ableism, and related topics has motivated her to become a change agent across contexts. Presutti Advocacy is Lauren's multi-purpose organization designed to foster global spaces where disability can be seen, accepted, and valued. Tailored services are provided to individuals, families, groups, professionals, corporate businesses, nonprofits, schools, communities, and wider audiences. Lauren holds a bachelor's degree in sociology from Central Michigan University and 3 graduate degrees from Grand Valley State University, a Master of Education, an Educational Specialist degree, and a Master of Social Work. Lauren has provided us with some fantastic handouts to accompany the webinar, and these can be viewed via a link which can be found in the chat feature. I will also be sending these handouts to you tomorrow via email, so you will have them that way as well. And in addition, we do have closed captioning available, and that as well you can access via the chat feature. And with that, I will turn today's presentation over to Lauren.
Thank you so much, Rebecca. I am going to close my video for now, but I will open it up again at the end when we have questions. Thank you so much to all of you for joining us today. I think as mentors, all of you play such a vital role in the peer and family support program, and we're really glad that you're here today. I'm honored to be partnering with the Christopher and Dana Reeve Foundation to talk with you all about stress management, healthy coping, and how you can teach this information to your peers. I really hope that you find this information helpful, and please take note of any questions that you may have throughout the slides, because we're going to have some time at the end, like I mentioned, for questions. So our outline for today is going to look like this. Why is stress management so important? What are some strategies for teaching healthy coping? So we'll really dive in and talk about those strategies. Then we're going to review some main takeaways that you can walk away with after this webinar. And then, like I said, we'll definitely have time for questions, and I'm hoping we can have some great conversation at the end. So we really have a lot to cover, so let's dive in. So we're going to start by understanding why stress management is so important. So what is it about stress and mental health that makes this such an important topic for us to cover today? So whether someone is living with paralysis themselves or helping to support a family member or a friend living with paralysis, developing a meaningful life when paralysis is part of the picture requires stress management. And that's because of all of the things that we face when we live with paralysis or when we're helping to care for someone with paralysis. There are going to be so many ups and downs. Tolerating adversity and tolerating those distressing moments in healthy ways can help people maximize their feelings of empowerment and have the greatest amount of control over their lives. And that's what we want. We want people to feel empowered. We want people to feel like they are able to define their life and discover their full potential, even with living with paralysis or living with a disability. And for those reasons and more, it's really vital for both individuals living with paralysis and the people in their support systems to learn and implement strategies for healthy coping. So when we think about someone that's newly injured, it's really common to feel like their whole world has been flipped upside down. That adjustment process to a new normal can feel incredibly overwhelming. And the process of understanding limitations, identifying opportunities to reclaim independence, learning to reestablish purpose again, and holding on to a sense of hope and determination might feel really difficult or really painful at the very beginning. And it makes sense that all of these new challenges will likely bring on a great deal of stress for people adjusting to life with paralysis. For the mentors here today who live with paralysis themselves, take a moment to reflect back on your own recovery process. Think about everything that you went through when you were first diagnosed. I understand that everyone's experience will probably look different, but it's probably safe to assume that there were at least some feelings of shock, frustration, and added stress as you adjusted to life with paralysis. Even for people with a long history of paralysis, there are still going to be a lot of things throughout the lifespan that require energy and attention. You may have conquered some of those initial feelings of distress in the very beginning of your journey, but over time, you probably faced additional stress as your life continued forward. This may be especially true if you faced barriers during any life transition, like graduating college, for example, starting a new job, entering a new relationship, having kids, moving to a new city, or any other number of life events. Living your life as fully as possible with paralysis requires that you continue to manage your health, advocate for accommodations whenever you need them, persevere through barriers, and cope with disability related misconceptions and stereotypes all the time. So, again, here to think about some of the stressful things in your own life. Unfortunately, nobody can avoid stress completely. That's what we would want, to avoid stress all the time, but it doesn't work that way. We all face stress from time to time again, and we can develop healthy coping skills to manage it so that we can stay in control. And we also have to really think about our family members, our friends, caregivers, and all of the people that are involved in the life of someone living with paralysis, because they are not exempt from stress either. For example, it's really common for caregivers to feel overwhelmed if they don't have the time or the ability to prioritize stress management. Family and friends may struggle emotionally with watching someone that they love so much experience barriers or life with paralysis in general, or they may feel helpless not being able to solve some of the problems that their loved one is facing. And all of these things and more can lead people to feeling increased levels of stress. And it's equally important for this population to focus on stress management. So, for the family and the caregiver mentors that are joining us today, take a moment here to reflect on your feelings and thoughts as you navigated your own journey loving someone with paralysis. Your experiences are just as valid and important as the experiences of those living with paralysis. So, overall, managing stress allows us to feel more positive and experience more joy. Absolutely. If we are able to manage stress, we're going to be more likely to feel happiness, feel positive about things, go into opportunities with excitement. We're going to have reduced feelings of hopelessness and despair. We're probably going to be more likely to develop goals and make progress toward those goals. We're going to have better friendships and relationships. We're going to be able to cope with the unexpected challenges of life. And we're going to work more productively and efficiently. And overall, we're really going to contribute more to our communities. So, establishing healthy coping skills will help us in all of these things. And if we think about all of these things combined, one of the commonalities is resiliency, problem solving, adaptation. Through all of these benefits of stress management, we're going to increase our problem solving abilities. We're going to increase our adaptation abilities and our ability to have a growth oriented mindset when things don't always go exactly as planned. On the other hand, if we struggle with managing stress, we may experience worsening symptoms like anxiety, depression, or other concerns. We may be more likely to feel negative about the challenges that we face, and that's probably going to make us feel more and more isolated. And those are all things that we certainly want to avoid. So, before jumping into our strategies, I want to remind you all of the impact that you have on your peers. All of you play such a vital role in teaching lifelong skills by providing encouragement, listening, sharing your experiences, leading by example, offering advice, and so much more. As we explore teaching stress management, consider how your mentorship practices relate to the ideas presented here. I imagine that a lot of what you guys are already doing such as actively listening to your peers and providing empathy, will be important practices to continue as you talk with your peers about stress management. So now let's dive into some of these strategies. And I want to preface this by stating that not all of these strategies may work for you. You may find some of these strategies to be exactly the things that really resonate with you, and you may find some of the other strategies to not be things that you want to dive into, and that's okay. The goal of this webinar is for you to walk away with at least some new information on how you can teach healthy coping skills to your peers. But remember that you can tailor your own experience and develop your own plan for how you're going to teach this to your peers. So, the first strategy to teach healthy coping is to promote self care. So, practicing self care means doing things for ourselves that are going to help us feel better. It's about doing things that are going to help to alleviate some negative stress or energy inside of us. I know that we all see things about self care all over the internet today, and there's a lot of different misconceptions about what constitutes self care or what self care really looks like. But I want to point out that self care can look very differently for different people, depending on what activities you find to be the most helpful in relieving your stress. Many people feel empowered when engaging in self care activities because it means that they are taking control of your mental health and allowing yourself the time and the space to do something that can elicit feelings of joy and relaxation. Understanding what self care activities are going to work best for you might mean learning more about yourself and getting curious about what helps you and what doesn't help you. Often, we have to go through some trial and error to figure out which self care activities work best for us. This can mean exploring lots of different activities to de stress and holding on to the ones that work and just throwing out the ones that don't work. The more that we practice intentionally making time for our own self care, the more resilient that we become, which ultimately helps strengthen our ability to cope with distress. And it helps us manage whatever comes our way. As we continue to face adversity, we're going to be more likely to handle that difficulty with grace and move forward stronger if we're practicing self care and remembering to prioritize our own needs. And I also want to mention here that for caregivers specifically, prioritizing self care means giving yourself the same compassion and grace that you give to others. So, growing up, a lot of us might have been taught that, we always have to be giving toward other people. We always want to serve others. And of course, that's a great quality. It's a great quality to be giving toward others. But I don't want you to mistakenly believe that taking care of yourself is by any means selfish because it's not selfish at all. In fact, how can we possibly take care of other people if we're running on empty ourselves? The truth is, we all have mental health needs that we have to take care of. And if we are neglecting our own self care, then we may become resentful, exhausted, or completely burned out. So, self care helps us recharge our batteries so that we can show up for ourselves and the people that we care about in authentic ways. So, how can this be taught to peers? I think first we can lead by example. So, you can lead by example for your peers and discuss how you practice your own self care. You might find yourself saying things like, "Yesterday I was really stressed, so I decided to unplug from electronics for the night and play board games instead." Or you might say, "I feel like I've been working too much lately, so I planned a night of total relaxation just for myself." I think it's really important to know that your words have an impact on your peers. And if you can lead by example by sharing stories with your peers, giving them specific examples of how you practice your own self care, that can have a really significant influence on them. You also want to be sure that you're discussing self care as an essential life skill, not as a luxury. So I know sometimes on social media we see self care, and there's pictures of fancy bubble baths or expensive shopping trips or these luxury things. But that's not really a reality for most people. More often than not, self care may be something really simple, like just some simple meditation or breathing exercises. It might mean going to bed early, making sure that you're getting enough sleep, maybe doing a craft, watching a movie, or any other basic activity that helps you feel more relaxed. So it doesn't have to be anything extravagant or luxurious by any means. We also need to make sure that we're reminding peers that self care doesn't have to be traditional. So everyone's experience with self care will be different. Don't be afraid to discover new hobbies, even if they seem a little non traditional. For example, some people like collecting coins or learning to crochet, or maybe just going for walks in the park and taking pictures of flowers. I mean, people do all different sort of things for themselves. And even if it seems like maybe a bizarre hobby, like doing some improv online or, doing some random puzzle game or whatever the case might be, don't worry about what other people think. Just do the things that you like to do. And it doesn't have to be the same activities as other people. It's also really important that we prepare to respond to I don't have time for self care, because that is something that a lot of us hear from people when we bring up conversations of self care. We talk about it, we say, yeah, it's really important that we're taking care of ourselves and making time for self care. And sometimes our friends or people might say, oh, I wish I don't even have time for that. And so, how can you prepare to respond to that in an effective way? How you can respond to that is by giving examples of self care activities that can be done in small quantities of time, or helping your peers identify how much time they have and then discovering some things that they can do in that time frame. So, even if you only have 1 to 5 minutes, here are so many different things that you can do to give yourself a mental break, even in just 1 to 5 minutes. And you don't need to memorize these because I have included these in your handouts. So, just like Rebecca mentioned, the handouts will be emailed to you. You can also access them in the chat box right now. So, don't worry about remembering these. We're just going to quickly go through some of these things so that you can see that I've broken them down into the 1 to 5 minutes, the 5 to 20 minutes, the 20 to 60 minute activities, and the 60 plus minute activities. So you might want to suggest some of these to your peers and say, "Hey, I know that you say you don't really have a lot of time for self-care, but have you considered how much time you do have? Oh, maybe you only have 20 minutes or so. Well, let's talk about some of the things that you can do to give yourself a break, to recharge your batteries, to give yourself that time to relax." So talking with your peers specifically about what activities can be done in the time frame that they have can make a big difference. Just a quick note on adaptive recreation. For peers living with paralysis, one self care activity may be some form of recreation. And sometimes trying new things can be really scary because of fear of failure. Specifically, people living with paralysis may at first be a little reluctant to try something like adaptive recreation because of the perceived barriers that come with outdoor activities. And my suggestion is to encourage your peers to think about the possibility of just giving it a try. You never know what they may find to be accessible for them. They may discover that they love downhill skiing or hand cycling or any of the other numerous activities that many people living with paralysis enjoy. It may be a good idea to watch some videos online together about adaptive recreation, share news articles or blogs that you find on the subject, or talk about some of your own experiences trying new types of recreation. The important thing is to simply get a conversation started, talk about how recreation can be a form of self care, and see where it leads. And for family, friends, caregivers of all types, encouraging these peers to stay active and try new things outdoors can be equally beneficial. Again, sometimes it's hard to get out and try something new, but discovering new types of recreation can make a big difference for stress management. And that's because we know in the mental health field that recreation across the board for all different types of people directly connects to stress management because it shows that staying active, getting outdoors, has a direct impact on positive mental health. The research has shown that having recreation opportunities that you enjoy gives you something to look forward to. It helps you feel more connected to a social atmosphere, and it helps improve your confidence for engaging in new activities of all types. And all of these things combined are known to lead to healthier coping skills. So, another strategy as we move on is to explore with your peers where their stress is coming from. So, identifying where stress comes from can be really important because sometimes it's not that easy to identify why we're stressed out. Of course, sometimes it may be easy, like when we know that we're starting a new job or moving to a new city or experiencing the death of a loved one. In those cases, we know that this is a disruptive event in our life and we're really stressed out about it. But what about other times? Other times it can be more complicated to pinpoint exactly where our stress is coming from. We might be so preoccupied with our day to day responsibilities that we actually start overlooking the sources of our stress. This makes it especially important to be mindful about how we're reacting to life demands. So we have to notice how our mind and body might be reacting to stress. For example, we may notice that we're having difficulty sleeping, or we're being easily agitated, or we're feeling restless, or we're having low energy. And when we notice those bodily changes, that's a clear sign that we should pause and start to explore what in our life may be causing stress. So there are both external causes of stress and internal causes of stress. So external causes may include any of the following things: major life changes like being diagnosed with paralysis, grieving a loss, a death of a loved one, relationship challenges, employment difficulties, maybe too many social commitments, so overloading our calendars and not having enough time for relaxation, maybe children and family stress like struggling with family dynamics, or day-to-day inconveniences like getting a speeding ticket or feeling stressed out about the way that your schedule looks or just not having very much fun in your life. These are all external stressors because they're things that are going on in our environment that is causing us stress. But on the other hand, we also have internal causes of stress. Internal causes may include persistent negative thinking. So, when we get really wrapped up in a lot of negative beliefs about ourselves and we just get really pessimistic about any hope for our future, that type of chronic negative thinking can lead to a lot of stress. Disqualifying the positives. So when something good happens, we just, that doesn't really matter. We're just going to put that to the side. We're not going to, we're not going to celebrate that positive thing. So kind of discounting it. If that's a habit that we have, that may lead to greater stress because we're not enjoying the things that are positive in our lives. Inability to tolerate uncertainty. So going along with that, if we don't have any flexibility, if we have highly rigid thinking, meaning, we have a very specific set of rules in our head for how things are going to look, and we don't allow ourselves to be flexible, that can absolutely add up to a lot of stress. Negative self talk, so lack of self esteem. This means that, we're always beating ourselves up. We're always telling ourselves that we're not good enough or that we're not capable of things. That can lead to a lot of stress. Unrealistic expectations of ourselves and others. Absolutely. That's a great factor that can bring on a lot of stress. Holding an all or nothing mindset. So, again, this would be if we're telling ourselves that, we're all good or we're all bad, or an experience was all good or all bad, or we either succeeded or we failed. That all or nothing mindset can bring on a lot of stress because, in most cases, there's a lot of room for flexibility and gray areas. But when we don't allow ourselves to think flexibly like that, it can bring on a lot of stress. Perfectionism, going hand in hand with that. Absolutely. When we are perfectionist in the way that we do things, that can bring on stress too, because in most cases, life is not perfect, and the people that we have in our lives are not perfect. And holding ourselves to those perfectionist standards will likely bring on a lot of stress. Jumping to conclusions, that's another internal source of stress, or blaming others or making should statements. So again, if you're noticing that your peers are doing this or doing any of these things on the list here, it would be worth a conversation about it. It would be worth, talking about these types of thinking patterns and asking them, do you think that this is something that's causing you greater stress in your life? This might be something that we want to work on or something that we want to try to avoid doing. So, how can this be taught to peers? So, I would really recommend talking openly about what is causing their stress. So you want to be actively listening to their narrative, working to create a safe atmosphere, validating and accepting their stressful experience without judgment, showing empathy by connecting it to a time when you felt similarly stressed. I think that is always a great skill, showing empathy and showing relatability by talking to them about when you have felt stressed similarly in the past. You also want to be encouraging peers to keep track of their stress. This is really important if they tend to experience a lot of chronic stress over time. It's important for them to be able to see patterns or common themes. So maybe recommend having a stress journal where they write down the things that are causing them stress, or maybe using an app on their phone. There are so many apps now on your phone where you can track what stresses you out, where you can just make little notes on your stressors, and then you could talk about it with your peers and say, what have you noticed from this past month? What are some of the biggest things that you have found really stressful? It's also important to talk about the importance of knowing your triggers. So, this is really critical and it helps peers or all people in general. It's really helpful for us because it helps us to know the signs or the symptoms that we can identify when we're starting to feel really stressed. So, you might just ask your peers, hey, I noticed that you've been pretty stressed. Are there things that make your stress feel more intense? What patterns do you notice? What are some things that you notice about your stress? Do you know what your triggers are? And maybe even pointing out some of their triggers. You could say, yeah, I've noticed that, every time you're around, this friend or this family member, you seem to get really stressed out. I wonder if you've noticed that. Is there a way that you can maybe minimize that type of stress in your life? Maybe set some boundaries. What are some things that we can brainstorm together based on the triggers that you have? Another great strategy that I personally love for managing stress is to create a tailored plan for yourself. So, making a personalized plan for addressing stress. This is something that can look a lot of different ways, but it's one of the most important strategies for healthy coping because it's individualized for you. It's a great strategy to encourage among your peers because it helps to empower them to take control of their stress and feel most confident in handling adversity. So, there are many different quick ideas for tackling stress that I'm going to share with you on the next few slides. And I want you to also know that those are going to be in your handouts. But again, I want to preface this by saying that you're probably not going to adopt every single one of the ideas on the next slides. Similar to figuring out which self care activities work best for you, you're going to be using the method of trial and error to figure out which coping skills will help you the most. Many people find it helpful to create a personalized plan on a piece of paper, in a journal, or on a small poster. You can also make one electronically. You may want to use bright colors, pictures of things that help you feel relaxed. If any of you have ever made a vision board, this is really similar. You're essentially making a vision board of coping skills that you can refer to when you feel stressed. You may want to include some positive quotes that inspire you, pictures, anything like that. The idea is to develop a plan on paper or electronically so that you can have it available to you, maybe in your pocket or on your desktop computer, right on the desktop as an icon. The next time that you feel overwhelmed, you can easily open it and look at your plan. And doing that will help you identify what's going to be helpful in that moment. So it'll be a list of these concrete ideas for managing stress in the moment when you feel like anxiety is beginning to feel a bit too much. So the first step is to really consider which ideas are going to resonate most with you. And as we go through these slides, again, you don't have to remember these because they're all in your handouts. So don't worry about writing all of these down. And I'm not going to read off all of them, but I just want you to look at these a little bit and I'll mention a couple of them. So maybe taking a break by detaching yourself from the stress, breaking large responsibilities into smaller pieces, making lists of what you need to do, reframing obstacles into opportunities, remind yourself of the bigger picture. Will this matter in the future? Adjusting your standards and expectations, maybe asking yourself, are you asking yourself too much of yourself? Take a moment to practice gratitude and introspection. Maybe do some deep breathing, find something that you can see, hear, touch, smell, or taste. Let go of the things that you can't control. Remind yourself that nobody has all the power. Look for the upside. Look for the silver lining. What can we take away from this experience? Visualize a positive outcome. Try to imagine things turning out well. Make a list of pros and cons. Try to bring humor into the situation. Sometimes humor can help us when we're feeling overwhelmed. It just helps break the ice a little bit and gives us a mental break. Write a list of your personal strengths and characteristics. Consider challenges as opportunities to grow. Practice assertive communication to express what you need. Show yourself appreciation and self compassion. Maybe de escalate emotions by reminding yourself that stress always passes. Look for the gray areas. Can anything become more flexible? Determine if any deadlines, decisions, or dilemmas can be delayed. Absolutely. Sometimes the biggest point of stress is knowing that, we have this pressure to make a decision or meet a deadline right away. But sometimes it's helpful to step back and ask yourself, can this be delayed? Can I have an extension on this? Reflect on the worst case scenario and assess the likelihood of this. Identify faulty thinking. So, are we exaggerating? Are we overgeneralizing? Are we thinking in black and white terms? What is going on with our mental space? Are we too pessimistic? Are we judging ourselves? Are we thinking too critical of ourselves? Identify your thinking pattern. Identify if you're having any of those internal stressors, like I mentioned on a few slides earlier. Maybe normalize your symptoms of stress. Remember that you're human. I think that should be on everybody's plan, just to normalize your symptoms of stress and remember that we all go through times of stress and you're not alone in that. Acknowledge your emotions instead of ignoring how you feel. Absolutely, that can be a great one. Allow yourself space and time to decompress. So maybe just taking a break, stepping away from the environment, giving yourself a night off, some downtime. So all of these ideas for your plan are included in the handouts, and I want you to know that this is not an exhaustive list. These are about 30 things total that I came up with that you may want to include on your personal plan for attacking stress. But remember that you can brainstorm and tailor your plan however you want. The goal is to just write some of these coping skills on paper so that you have a plan whenever you feel overwhelmed. You can look at those concrete skills and ask yourself if you can do or adopt any of these to help yourself feel more relaxed and a little less overwhelmed. You might even say to them, yeah, I was listening to this webinar. I found it really helpful to write down the coping skills that really work best for me. Do you want to brainstorm to figure out some coping skills that work best for you? Do you want to make a personal plan for your stress management? I think it can be really helpful the next time that you're feeling really anxious. You can have a set of coping ideas already written down. Remind peers that your plans can be revised as needed as they discover what works. So you don't have to worry about, you know, is this going to be set in stone forever? Remind them that the plan can always change. They can add to it all the time. Encourage peers to slow down during times of stress, step back, and remember that they can rely on their plan for coping. Provide positive reinforcement to peers. So you might want to say some of these sentences here, like, those are really great coping ideas. I can see how those would be really helpful for you. Or, I love how you created this plan on paper, so you can always have it in your pocket. Or you might say, this seems like it'll be really helpful for managing unexpected stress. So you just want to be providing that empathy, that validation, that positive reinforcement for your peers so that they know that they're doing the right things for themselves. It can help increase their confidence and their commitment to their stress management plan. So, another strategy for stress management and healthy coping is to make sure that we have opportunities to express ourselves. Some feelings are really hard to verbalize, and sometimes we have thoughts that we don't want to say out loud. But when we deny, avoid, or hide our feelings, we are probably going to experience greater stress and we can have more problems and we can feel isolated and our emotions will build up inside of us more and more and they might become worse because we're bottling them up inside of us. and we might experience feeling out of control. Excuse me. Avoiding self expression can also put strain on our relationships, and we are likely to feel misunderstood. But on the other hand, when we express our feelings honestly, we are better equipped to deal with them because we actually know what we are feeling instead of denying it. Self expression often leads to feeling more connected to people, feeling more relieved, empowered, supported, and understood. Specifically for people living with paralysis, sometimes it can be important to express yourself and normalize your emotions because it helps you honor how you're feeling, however you may be feeling. Sometimes people living with paralysis may be subjected to a stereotype that says people with disabilities have to be strong all the time. Unfortunately, sometimes that's a stereotype in the world because sometimes able bodied people think of individuals with disabilities as being inspirational or brave or strong and happy all the time. So sometimes we see that in the media. Like if you've seen stories about how, someone with a disability is inspirational because they've been strong all the time. But what I really want you to know is that you don't have to be strong, inspirational, brave all the time. It's perfectly okay to feel sad, discouraged, or disappointed when you're faced with challenges. It's okay to grieve the loss of ability, and it's okay to talk openly about your difficult experiences. Having a wide range of feelings, both positive and negative, is really healthy. And it's okay to express those negative feelings. The same is true for families, friends, and caregivers. You may find yourself wanting to be strong for loving your loved one with paralysis all the time, and you want to be strong for them. But it's unrealistic to expect yourself to never have painful emotions. It's really important that you have an outlet to express how you feel so that you can maintain your own health and energy. Suffering in silence and holding on to negative emotions that are buried inside of you is going to lead to worsening symptoms of anxiety and depression. But when we are fully aware of our emotional reactions and when we have safe spaces to express how we feel, we are more likely to experience a reduction of stress and develop confidence in handling adversity. Overall, expressing our feelings helps us to advocate for what we need and what our loved ones need as well, which is especially important for family members and caregivers. So, how can this be taught to peers? Help your peers discover their barriers to self expression. So, if your peers are having a hard time talking about their feelings and expressing themselves, try to figure out what might be getting in the way. Possible barriers might include afraid to express emotions because they may be afraid it'll cause conflict. So, to counter that fear, remind peers that expressing emotions is actually very useful for problem solving. If your peers say that they don't want to express themselves because they don't believe that it'll change anything, remind your peers that expressing emotions actually helps people feel better. It usually feels much better to get things off your chest and not keep it all inside. Maybe they don't want to express themselves because they don't want other people to worry about them. Maybe they don't want their caregivers to worry about them. Remind your peers that people love and do care about them and their emotional health. And even though they may not want others to worry about them, usually it's going to foster better relationships and closer relationships when we can talk about feelings openly. It actually brings people closer together. Maybe your peers are afraid to admit that they feel that way, that they feel pain or stress from time to time. Remind your peers that everybody has painful emotions and it doesn't make them weak or abnormal or different. They're just human like the rest of us. Maybe your peers are afraid to express themselves because maybe they're afraid that they don't have anyone safe to talk to. Remind your peers that resources are available, such as talking to a doctor or a therapist or joining a support group of some kind. So, as we wrap up these strategies, I really want to remind you that you can always reach out for help from a trusted adult or mental health professional if you feel like you or your peers are struggling with stress management, anxiety, depression, relationship issues, feeling isolated, feeling overwhelmingly misunderstood, struggling with feeling inferior, or any other mental health concerns. Some of the main takeaways that I really want you to walk away with are the following. Mentors have a very big impact on peers. So remember the impact that you can have. Even if you feel like what you're doing isn't mattering or isn't making a huge difference, I want you to remember that even just by leading by example and offering some validation and empathy, that can go a long way. That can make a very big difference. How can mentors help peers with stress management? So, we talked about the importance of healthy coping and why healthy coping is so critical to building a meaningful life. We talked about prioritizing self care activities. I also wanted to mention, along with self care, that right now with the pandemic, self care might just look like limiting your news consumption. So many of us right now are exposed to everything in the news, and it can be so depressing. I didn't mention that earlier, but I just wanted to bring it up now because sometimes not even doing a self care activity in the form of, going outside or doing something, but sometimes just turning off the television, that can be self care in and of itself. So, just limiting the amount of news that you're consuming, that can absolutely be a form of self care. Also, you can help your peers identify where their stress comes from. So remember, we talked about, external stressors versus internal stressors and how you can have some conversation about where your stress is coming from and talk openly about that. And then helping peers create a personalized plan for tackling stress. So, all of those ideas that you can put on those plans that we talked about will be great to suggest to your peers. Tell them it can be really helpful to write down some coping skills during moments that they're having a good day so that they have that in their pocket when they're having a bad day. And also teaching peers about self expression and really encouraging them to talk about their feelings. Their feelings are valid no matter what they are. They don't have to be strong and happy all the time. They don't have to pretend like everything is perfect if they're going through a difficult phase. They can absolutely have the safe space and freedom to express that. So, some final thoughts. It's okay to not know all the answers or not do everything perfectly. You don't have to be a mental health therapist to help improve someone's mental health. You can simply be a supportive friend, a listener, someone that can help encourage them, someone that can promote healthy ideas about coping. That can make a big difference. But if you don't do everything perfectly, that's okay. You're not expected to. You're just expected to listen and be authentic. That's really the most important thing, to be honest and be authentic with your peers. Be open to accepting their experiences with stress, even if it differs from yours. So even if they're, having a lot of anxiety about something that you don't really understand, maybe in your mind you're thinking, well, I don't really understand why they're so stressed out about this. Remember that everybody experiences stress differently. So just because their experience may be totally opposite from yours, that doesn't make it any less real to them. So validate their experiences. Remember that everybody's journey is unique. Everyone will experience stress management differently. Everyone will cope in healthy ways differently. And I think the most important thing is to just always let them know that you're there for them. And if you're struggling with mentorship or you want to discuss stress management more, use your resources. Talk to the Christopher and Dana Reeve Foundation mentor coordinators. Reach out to me directly. I would be happy to support you. Just don't be afraid to ask for help because you don't have to go through this alone. And if you're struggling to support one of your peers, there are people available that you can consult with.